Hello, everyone, and welcome to Dentist's Coffee Time. Today, we're doing a deep dive into a field that, well, often gets misunderstood: dental aesthetics. We find it's often talked about as needing some kind of innate artistic talent, like only a few gifted people can get really great results. But our mission today is to show that aesthetic success isn't some mysterious art form. It's actually based on a systematic, science-backed evaluation framework. And this framework, it applies across so many restorative treatments, from implants to fixed bridges.
That's absolutely right. This whole talent idea is a huge barrier for a lot of clinicians, and maybe even for curious patients too. If you weren't taught a systematic way to think about design early on, aesthetics can feel, well, kind of intimidating. You might think it's just subjective, impossible to really grasp. But that's exactly what we're here to break down today, to clearly define the scientific foundations of aesthetic design.
Well said. Before we jump right into the science of the design itself, maybe let's take a step back. Where did this discussion about aesthetics even begin?
It definitely didn't start with digital smile design software, right? No, definitely not. Historically speaking, the early conversations about aesthetics were really driven by prosthodontists. We're talking, say, before the 1990s. Their main focus was on how to reconstruct beauty when natural teeth were missing what they sometimes called competential potential. Basically, designing a set of dentures for someone with no teeth that looked both natural and, nice.
Ah, okay. So the initial drive wasn't making existing teeth look better, but making teeth created from, well, nothing look convincing and real.
Precisely. That was the core task. And speaking of history, you really have to mention a key milestone, Rumpa's classic paper from 1973. That paper was pretty foundational because it started to elevate aesthetics from just subjective opinion towards something more objective, more measurable. It began formalizing the elements of what makes a tooth arrangement look good.
Right, starting to build the rule book from the ground up. So how did aesthetics make the leap from denture design to the focus on anterior restorations we see today?
Well, after that initial push, things were relatively quiet for a bit. Then, around the 1980s, you started seeing fixed bridges become more common, and crucially, new materials like all ceramics, what was often called PV material, back then, started coming onto the scene. That's when the focus really shifted squarely onto anterior restorations, and the field just exploded around the year 2000, especially with the integration of implants in the anterior region. Now, aesthetics is sort of the common language across many dental specialties.
Okay, interesting. So if we strip away that art label, like you said, you mentioned there's a core structure for evaluation. How does that framework actually work? It must need to guide someone through potentially complex cases without getting lost.
The key is the methodology. Aesthetic evaluation and design have to be systematic. We follow a big to small approach. This is essential for any patient needing aesthetic work, whether it's veneers or implants or bridges. We basically break it down into 3 tiers. Tier 1 is macro analysis, that's facial analysis. The broadest view possible, looking at the entire face. It's about understanding how the dental features fit within the context of the whole face.
Okay, like a photographer taking a wide-angle shot first,
Yeah.
right? You have to place the dental features on the larger canvas of the face.
Exactly. You assess the overall environment first, then comes the second tier, meso analysis. This is about the oral-labial relationship, or you could call it mouth-lip analysis. Here, we zoom in a bit. We focus specifically on the relationship between the teeth and the surrounding soft tissues, basically, the lips.
And this is more dynamic, I imagine. Not just static teeth, but how they interact with the lips when the patient talks or smiles. That's why just designing on a model isn't enough, right?
Absolutely right. It's dynamic. We've gone from the whole face down to the mouth area, looking at smile lines, lip symmetry, how much tooth is shown. This tiered structure makes complex design decisions much more manageable and repeatable.
That structure definitely provides a clear roadmap. Take a break. We'll be right back.
1 second, pause. Welcome back. We've established the macro, looking at the face, and the meso, focusing on the lips and mouth. Now we need to push that camera right in, zoom into the smallest details.
Yes. Now we enter the third tier, microanalysis. This level focuses entirely on the morphological features of individual teeth, particularly the anterior ones, the central incisors, lateral incisors, and canines. And this is why hands-on clinical practice, things like carving wax-ups or understanding morphology, is so important. Microanalysis demands that you grasp the subtle differences between, say, a central incisor and a lateral incisor. The central might need to be squarer, more defined angles, while the lateral is often softer, more rounded. So across these 3 levels of evaluation, macro, meso, micro, when a patient actually smiles, what are the absolute key design elements we cannot miss? This must be the core checklist that turns the science into a practical design.
There's definitely a comprehensive list, but every design has to start somewhere. And the critical starting point, really, for planning is the incisal edge positioning. This position doesn't just dictate tooth length, it directly impacts phonetics and occlusal function. Get the incisal edge wrong, and, well, the rest of the design is built on a shaky foundation. Then, naturally, we assess the aesthetic display. How much the incisal edge shows, the incisal display, and how much gum shows, the gingival display. This involves analyzing the upper lip's position during smiling to ensure gum display is within acceptable limits.
Okay, and this brings us to probably the most talked about ratio in aesthetics, the golden proportion. But I want to challenge that a bit. Is it still the gold standard, and does it refer to the width we see or the actual measured width?
That's a really insightful and crucial question. The golden proportion, roughly central incisor to lateral incisor to canine, being 1.61 to 1.0 to 0.6 first. You have to understand it's a group proportion. It applies to the apparent or visual width of the teeth when viewed from the front. It describes the visual effect, not necessarily the actual measured width. Clinically, because of the arch curvature, the lateral incisor's actual width is usually much less than what the golden proportion might suggest mathematically.
So it's more like a guide, something we use to shape teeth and position them to sort of trick the eye into seeing harmony, rather than a rigid mathematical formula we must follow?
Exactly. It's a guideline, not gospel. And modern aesthetic trends actually show that many people prefer a more natural look, perhaps with less dominant laterals than the classic proportion suggests. We also need to analyze the proportions of individual teeth, like the central incisor's own width-to-length ratio. And still on the micro level, there are other key landmarks you just can't ignore. The incisal angle, the size and position of the contact area between teeth, the highest point of the gum line, the zenith, the incisal embrasures or spaces, and of course, the dental and facial midline alignment.
Let's talk about that gum point, the zenith. What happens if those aren't aligned correctly?
If the zeniths aren't harmonious, meaning typically the central and canine zeniths are at a similar height, with the lateral zenith slightly lower, maybe 0.5 millimeter to 1 millimeter, the visual result can be, well, disastrous. Teeth can look like they're different lengths, or the whole smile line looks uneven. We call this gingival harmony, and it includes the fullness of the papilla between the teeth and the smooth flowing line of the gingival margin itself. And finally, we also evaluate the buccal corridor. That's the dark space you see to the sides of the back teeth when someone gives a really wide smile. If that space isn't managed properly, a smile can look kind of flat, lacking depth.
Wow, that list really drives home how rigorous the science is. But beyond just the visual aspect, how do we tightly integrate form with function? How do occlusion, the bite, and phonetics speech fit into this incredibly detailed design structure?
That integration is absolutely non-negotiable. You simply cannot artificially separate aesthetics from function in treatment planning. You have to consider occlusal analysis when you're doing anterior restorations. For instance, the length or angle of the front incisal edges directly affects the patient's guidance in biting. If it's designed poorly, it could lead to occlusal trauma, maybe even chipping or failure of the restoration down the line. And phonetics. The impact is even more direct. How the teeth and lips interact during speech is highly correlated with aesthetics. When we design teeth, we have to ensure the patient can make specific sounds correctly, like S or F sounds. Imagine if we make the incisal edges too prominent. The patient might start lisping or spitting when they make an S sound. That completely undermines the aesthetic result, doesn't it? We have to find that perfect balance between how it looks and how it works.
So what this all tells us is, yes, the complexity is high, but that systematic macro-meso-microstructure combined with functional integration gives us a clear, repeatable path to success. That's really how we break that you need to be an artist myth.
To sum it all up, our deep dive today shows that dental aesthetics is really a systematic, multidisciplinary science. It demands we start with the facial context, macro, analyze the oral relationships, meso, refine the individual tooth forms, micro, and finally ensure functional harmony, occlusion, and phonetics. Success isn't about inherent talent, it's about mastering and applying this comprehensive assessment framework.
Which leaves us with an open-ended question for all of you listening. Considering how deeply interconnected form and function are, what's one non-aesthetic cue, maybe something like a speech contact point or a chewing pattern that you now realize might strongly influence your final aesthetic design decisions? Something to think about. Thanks for listening to Dentist's Coffee Time. Bye-bye.
1 second pause.